Well, hello, everyone. This is Marcy Gallagher with Mountain Pacific, and I am one of the long-term care account managers for Montana. And welcome to our 6th session of It's Worth a Shot. We'll go ahead, hit the next slide, Mary. So as always, we look for topics and ideas for future presentations. So feel free to add that into chat, and we will be continuing this series through April 13th. So today our webinar topic will focus on the Ombudsman as a vaccine resource with guest speaker Stephanie Wheeler, the Alaska State Ombudsman. And our clinical office hours portion will address general FAQs, changes, recommendations, pediatric vaccines with Kyla Newland. Kyla is also going to address a couple questions that we had from last week's presentation, so that will be wrapped up in the second half of our session today. So next slide, Mary. Just getting started, let's just begin with just some background information on the Ombudsman program, which actually started out as a demonstration project back in 1972. And every state has a long-term care ombudsman. They serve as an advocate and provide support for residents living in long-term care settings, such as our nursing homes or assisted living facilities. And when we started talking about ways to promote COVID vaccines for our resident population, the Ombudsman came to mind. So just a reminder, they can serve as a great resource, not only for residents, but for nursing home staff and leadership as well. So again, we want the session to be interactive, so please feel free to use the chat. But at this time, go ahead and advance the slide, Mary, and I'm going to turn it over to Stephanie, who has graciously agreed to share some of the things the Ombudsman program has been doing in Alaska during our pandemic. So Stephanie, the floor is yours. Thank you. Oh, you're maybe on mute still, Stephanie.
I'll repeat what I just said. Thank you, everyone, for inviting me to today's session. And thank you, Marcy, for that introduction. And as Marcy mentioned, we do have a long-term care ombudsman program in every state of the United States. And we also have one in Guam, in Puerto Rico, and also in Washington, D.C. So we're a pretty active group and have been so much so during the pandemic. Our work changed a little bit, and I'll go into that in a second. But I want to share with you that I started in my role 3 months prior to the pandemic. Oh gosh, what a change. So facilities shut down in March of 2020. We really had to scramble to try to figure out, how can we continue to do our work as advocates for residents in long-term care settings when we were not able to visit with residents in long-term care settings. So I'll share with you a little bit how we adapted to our work, but our lives have forever changed, right? Dramatically so. And think about those residents in long-term care settings. Yes, their lives were changed as well, very disrupted. And we dealt a lot with social isolation and really looking at, not having visitors for over a year. And so you can imagine some of the issues that residents were having. So our work really, what guides our work is that of really advocating for residents and on behalf of residents and really promoting residents' rights. So I want to preface everything that I'm saying to that guides our work, and that is residents' rights. And then, so residents really have the right to choose. So in the healthcare setting, that means that they have a right to choose their own medical doctors. They have a right to make decisions about their health and their care. And they have a right to be informed about what it is that they are, in terms of vaccinations, what it is that they are receiving, and everything surrounding the vaccinations. And that's what we are here for in terms of residents, helping them to and encouraging them to make their informed choices. So ombudsmen are frequently asked about vaccinations, whether it's by residents or by family members or by guardians or by staff. And so we try to provide updated information as much as possible. And how we do that is we are consistently involved with planning meetings. We have information coming from CDC, we have information coming from ACL, we have information that we receive from our public health department. And it's also an amazing opportunity to work in partnership with all of those entities throughout our state, so that when folks have questions, we're able to provide that information. And one of the things that we try to encourage is that that information can be easily shared with residents, but not only that, that the residents are able to understand that information. So whenever there's promotional material that comes out, we take a look at that material to see how we can improve on making it more resident friendly for those residents. We as ombudsmen provide individual advocacy to ensure that residents really are making informed decisions about vaccinations, about testing, about treatment, and about COVID overall. And we are committed to providing the most up-to-date information possible. I will share with you that we're involved in a number of planning meetings and a number of meetings per se. So our office facilitates a monthly meeting with assisted living homes. Next slide, please. I'm sorry. Assisted living homes, where we have invited our public health team to every monthly meeting, and they provide facility administrators with up-to-date information. And we're also part of the bi-monthly meetings with Mountain Pacific Quality Health, where we listen in and hear some of the concerns of skilled nursing facility administrators. And Dana Mitchell facilitates that meeting, but public health and health facilities and licensing, they are a part of that meeting as well. And they provide updated information to all of the skilled nursing facilities. So at the onset of pandemic, I mentioned that our work changed a little bit, so we weren't able to go into facilities. So we took a step back and we tried to figure out what was the best way to communicate to residents in long-term care facilities. So we set up a Zoom account and we started hosting virtual town hall meetings on a monthly basis. And that was an opportunity to communicate updated information to residents, but also to listen to residents to hear their concerns overall. And we were able to inform residents and family members about COVID-19 testing sites, providing that information, vaccinations, and of course, treatment. Once ombudsmen were allowed back into those facilities, and it was a year, right? March 2020 to March 2021, we were able to meet with residents one-on-one, to share updated information. We took promotional materials, and we continue to do that as well. We took promotional materials to facility staff and to residents. You know, we have identified lots of information to share with residents and family members and guardians and facility staff around vaccinations and boosters. And then, you know, when residents have an issue with trying to figure out whether or not this is the best decision for them, we also provide them with information on who to contact, right, in the public health department, or to contact their medical provider for additional information, so that they can be secure in knowing that they are making the right decision for them. We're always involved with resident councils, and so it is also an opportunity for us to communicate updated information to resident council members. Resident council members typically meet once a month. They invite us to speak at the resident councils, and they also know that we have updated information that we can share with them as it relates to everything COVID. And then, you know, our team in Alaska, we're a 6-member team. So our Alaska is, you know, pretty big. It's, you know, so we have assistant ombudsman or a deputy ombudsman that are assigned to each region. But I will share with you that we can't do our work without our amazing volunteers. And so we have volunteers in almost every community in Alaska. And so how do we use our volunteers? We have a volunteer meeting every month. And during our monthly meetings, training sessions, we provide up-to-date information around everything COVID so that they have the latest and greatest. We also send out material to our volunteers so that they can share that information with facilities that they are visiting. And then we also invite key speakers to our monthly training with our volunteers so that they are in the know about everything COVID, including, you know, testing sites, including vaccinations, including boosters, including treatment. So next slide, please. Well, before I go into social media, and I think we have all learned how to deal with social media over the last couple of years and technology over the last couple of years, because it really has almost been a saving grace for all of us to stay up to date with the latest information. We use our website to provide information to the public. So we retrieve information from public health or a Department of Health and Social Services on the latest information and on data, on treatment, on vaccinations, on testing sites. And we post that information on our website. We have a very active Facebook account. And, you know, we're always getting either complaints through the Facebook account or through our website, or we have questions that always come through our Facebook account or through our website. And again, it's an opportunity for us to connect with those folks who are on Facebook and have questions, or using our website and may have questions or have a complaint, to get back with those individuals and work with them to resolve any issues that they may see, or an opportunity to provide additional information around COVID-19. We, with assistant living homes administrators, we have a monthly meeting to help them stay informed about COVID-19, everything related to COVID-19. And we have a hub team that actually facilitates this meeting, including the long-term care ombudsman. We meet with our public health, Kim Spink, and her team that provide information on a monthly basis, updated information. We have residential licensing participating in that meeting, as well as the AARP Alaska, Teresa Holt, who used to be in this position, in the ombudsman position, but stays very much active as it relates to long-term care. And so that has been an amazing opportunity to communicate to assistant living administrators and also to hear some of their concerns as it relates to COVID and other things. So how has our work changed? I would like to share some statistics with you around our information and assistance and consultations with facility staff, and our individual advocacy as it relates to facility staff and also with residents. So in 2019, we provided 298 information and assistance or consultations with facility staff. In 2020, we provided 469 information and assistance or consultations with facility staff. And then in 2021, we provided 732 information and assistance and consultation to facility staff. Well, we attribute that to not being able to be in facilities to talk with facility staff, but the fact that facility staff also had tons and tons of questions and concerns around COVID-19. And this was an opportunity, is an opportunity to continue to build those relationships with facility staff and to help them get the answers to some of the questions or concerns that they may have. So you can see that in 2019, we had 298 consultations with facility staff to 2021, where we had 732 consultations with facility staff. That's a huge increase in the amount of individual and consultation to facility staff with our team. So in terms of residents and our individual advocacy, again, we were not in facilities for a whole year. So prior to the pandemic in 2019, we had 346 cases of information and assistance to residents, to family members, to guardians. And then that increased in 2020 to 545 information and assistance to residents, family members, guardians, and others. And then in 2021, that increased even more to 786 information and assistance and consultation to residents, family members, and guardians. But that lets us know that as a team, we were working really hard to try to help residents also, retrieve information about up-to-date information on COVID-19, whether it was, testing sites or looking for testing sites, or, what's happening with vaccinations or trying to get vaccinated, or treatment, what to do if, I'm sick and I feel like I need treatment. So next slide, please. So, I feel like this is going really, really quick. So resources to stay informed, as I mentioned before, we are very connected to our public health department. They have just been amazing throughout this whole process. Dana can tell you that we would all be lost without, because we're getting information from almost everywhere, from ACL, from the CDC, on the latest guidance on visitation. But our public health department has really been so very active and helpful when it comes to sharing updated information and materials to all of us, and especially with the long-term care ombudsman. We have been one of our other resources is the Consumer Voice, who also provides information on FAQs regarding the latest either ACL or CDC or CMS guidance. And then we have our National Long-Term Care Ombudsman Resource Center that provides us with up-to-date information. And of course, we have the current COVID-19 booster outreach tips for long-term care ombudsman information. And so it really has been very helpful to review the latest data. We can figure out where to target our efforts in terms of advocacy and sharing information to residents and family members and guardians. I just would love to, number one, thank all of you for helping to keep residents safe in long-term care settings and providing that outreach to family members, because it's just been critical of you, just kind of as a reminder of all of the information that comes out in different directions to all of us, and how difficult it is to decipher that information and to try to figure out what is the latest information as it relates to vaccinations, visitations, testing, treatment, a wealth of information. But it's been really helpful to really connect with our partners to make sure that we have the most updated information as possible, to help residents and their family members make informed choices. And I will close by sharing a story that occurred in one of our northern regions in Alaska. We had a family member who contacted our office. She was concerned because her family member and the residents in the assisted living home that she's connected to had not had their vaccinations, right? And so she was wondering what steps she should take to try to get her loved one vaccinated. And so she reached out to us, and we knew that there was a plan in place because every assisted living facility had a plan in place to get their residents vaccinated. They were contracted with the pharmacy. The pharmacy was supposed to go and do vaccinations with residents in this particular home. But when we contacted the pharmacy said, we're all out of vaccines, and so we don't have any to share with the residents in this particular home. Well, that didn't sit well with the family members and the residents in that home. So we contacted the person who was overseeing that process within that pharmacy, and they shared with us that they were trying to make arrangements to make sure that happened. But after a couple of days, we did not hear back from that pharmacy. So we contacted our friends over at Public Health, and they made sure that the residents in that home received vaccinations within a couple of days of the request. So it's all about really knowing who to connect with to make sure that residents' voices, concerns, and complaints are heard. And it's been a lot during COVID-19. And so the residents in this particular home were able to be vaccinated, and the family member was very thankful. that we advocated on behalf of the residents and the family member, and to get the residents in that particular home vaccinated. So are there any questions at this point? I think that's all that I have.
Thank you, Stephanie. I just love that story. And just folks, just again, remember that the Ombudsman are there to help, and make sure you reach out to them. Does anybody have any questions for Stephanie? They want to, I don't see anything in chat. Does anybody want to come off mute? Okay, and I think also on the call is Patty Hall. Patty is the long-term care ombudsman in Wyoming. Patty, did you have anything additional you wanted to add? I know you folks are pretty active in Wyoming as well. Okay. Well, if there weren't any other questions, let's go ahead and turn it over to Kyla. Thanks again, Stephanie.
You're welcome.
Yeah, thank you. And as Stephanie stated, things are changing. Recommendations are changing all the time. So I'm going to start out by going over just a couple updates the CDC put out last week and the week before. Next slide, please. On the recommendations for COVID-19 vaccines. Oh, I'm sorry. I'm going to start with the Q&As from last week. So there was a couple of questions that came up last week. If you attended, we had a presentation about the new therapeutics to treat COVID-19. So there was a question about Evusheld, which is the only approved therapy for prophylaxis of COVID-19 in patients that are at higher risk, or in patients that have a contraindication to getting a vaccine. So two questions came up. The first one was, how long do patients need to wait after getting a COVID-19 vaccine to receive this therapy? And the answer to that is 2 weeks. The second question was a little bit harder to answer. I couldn't find a definitive time frame in how long after actually having COVID they would have to wait to receive this therapy, but it would be plausible for them to wait about 90 days, because we know that folks that have COVID have really good protection for at least 90 days from reinfection. And also of note, this product, which is a combination of 2 monoclonal antibodies, was not studied in patients who had a history of having COVID. So nothing really solid on, on that, but we can probably assume they have good protection for the 3 months. And then after that, the clinician could consider giving them this therapy. Next slide, please. And the other question that came up is, there is a stipulation in the EUA for this medication, saying that if they were recently exposed, and this wasn't a solid answer either, but based on all the recommendations from the CDC for isolation and quarantine, it would be safe to assume that recently exposed would be within the 10 days prior. Did anybody have any other follow-up questions regarding these questions? Okay, next slide, please. So I'm going to kind of breeze through. I know we only have a little bit of time. So on February 11th, CDC came out with a couple significant changes to their recommendations for moderately to severely immunocompromised patients. So the first recommendation, well, it was more of a clarification, was just that these folks are potentially getting up to 4 doses of COVID-19 vaccine. And the second main big change was that booster dose was previously recommended to be 5 months after their primary series, and they reduced this timeframe to 3 months. And then they also changed the recommendation for the J&J vaccine. Previously, patients were supposed to get 2 doses, and now they've actually increased that to 3 doses, recommending preferential booster doses with mRNA vaccine. Next slide, please. And there was actually one more change that just came out yesterday that I'll mention, and that was in folks that are males in the age range of 12 to 39. They're recommending a potential extension of the period between their first and second primary vaccine dose of 8 weeks. So that's something that came out based on the fact that these folks are at higher risk for myocarditis. So this chart, this is just a really good reference chart. It's got the recommendation for the boosters and the timeframes that you can access via the link on this slide. Next slide, please. I'm just going to briefly, I know I only have a couple minutes, talk about pediatric vaccines and pediatric hospitalizations and dosing recommendations. So as you can see in this chart, with the Omicron variant, the percent of hospitalizations went up in the pediatric population. The hospitalizations were going up in all populations, but we might see a little bit higher in this pediatric population because they potentially may not be as highly vaccinated at this point. Next slide, please. And as you'll see on this slide, only 28.1% of 5 to 11-year-olds have actually received 1 dose of COVID-19 vaccine as of recently. And the rates in our states are actually, the only state that was higher than this was Hawaii, but all of our states were a little bit below this as well. Next slide, please. So just reasons for children to get vaccinated, they can still get very sick. They can have something called MIS-C, which is a hyperinflammatory condition that can happen usually within 4 to 6 weeks, or I'm sorry, 2 to 6 weeks after having COVID. So there is a lot of good reasons to protect children with the vaccines that are available. Next slide, please. So here's a chart. This just shows the approval. Basically for 5 to 11-year-olds, the only approved vaccine is going to be the Pfizer vaccine at this point, and they are studying that for the 4 years and younger population as well, which I will talk about on the next slide. This is side effects that have been noted. This is through the VSafe program that I believe I talked about last week, where patients self-report side effects that they've had to their vaccine. So really minimal side effects, pretty typical with most vaccines. Pain at the injection site, a little bit of fatigue, maybe a little bit of headache. And we've seen a few cases of, very few cases of myocarditis or any other significant adverse events in this age group. Next slide, please. So when they looked at the approval process initially for approving these vaccines for children, they started out with that higher age range, and now they're currently in process of doing the approval for 5 years and younger. And at this point, the CDC or the FDA, I'm sorry, put a pause on approving that, because what they found is that children 2 to 4 produced only 60% of the antibody levels that the older population did. So what they're currently doing now is they're going to go ahead and study this 3-dose regimen. And the reason that it may not have been as effective is that it is a lower dose. The other pediatric dose is 10 microgram. In this younger population, they only studied a 3 microgram dose. So they're going to try and give a 3rd dose and see if that can increase the antibody response. I think that might be my last slide. So a lot of information in a short period of time, but a lot of good resources here too. And thank you, everybody. If there's any questions, I'm happy to answer.
Marcy, I see that Patty Hall is available now. Did you have anything you wanted to add verbally? I see you put a comment in the chat box, Patty.
I know she was having trouble with her mute button. Patty, are you still on?
Looks like she just said she didn't have anything to add, so.
Okay.
Okay, thank you.
All right. Well, we are a few minutes over, so thanks everyone. And if there weren't any other questions, I don't think I'm seeing anything in chat. Just a reminder to complete that evaluation link. And will talk to you all next week. Thank you.